Welcome to another COVID-19 update. I am Stacey Carmichael and I'm joined by Minister of Health, the Honorable Dr. Frank Anthony. Good afternoon, Minister Anthony.
Good afternoon. Thank you for having me.
You're welcome. Some questions for you today. Concerns have been raised about limited staff at the COVID-19 hospital. How is this being addressed, Minister, and without any disruption to the regular service at GPHC or staff burnout?
Well, right now the COVID hospital is not fully operational. We have about 18 patients per day, and because of some of the challenges that we have with the infrastructure, right now we're trying to fix the plumbing into one section. And so these 18 patients have been moved into another area. So with 18 patients, we don't really need a lot of staff. Nevertheless, we have full team. We have medical doctors who are trained in infectious disease that will be on shift rotations, and we have nursing staff. At this present time, I don't think we have a challenge per se, because as you would know that the hospital at Diamond is not fully operational because of the repairs that we are doing at Diamond. And we have transferred a lot of those staff from Diamond to work at the COVID hospital for now. We also have staff from the Georgetown Hospital. So as of now, we have not really disrupted any particular service, and we have adequate persons at the COVID-19 hospital.
Thank you very much, Minister. Now, a number of private hospitals are doing what they call rapid tests. Now, these are not diagnostic tests. Are there any concerns from the ministry, or could you explain how these work?
Well, I mean, broadly, we can say that you have two types of testing. One test or one set of tests that would help us to find the virus itself, which we call an antigen test. And the other one is to look for the antibodies. That is, if you have the virus in your system, then after some time, your immune system would make antibodies. And so this particular test would look for the antibodies. So you have to be infected for some time before your body develops antibodies. So a lot of the rapid tests where they take a blood smear and put it on the strip, a lot of those tests are really antibody tests. And therefore, they're not going to help you to make a diagnosis of the infection, but what they can tell you is if in the past you were infected and you would have developed antibodies. So that's the big difference. The diagnostic test that we have is what you call a PCR test. The ones that we have currently are the ones that where you take the swab from someone's, the back of their throat. So you have to put it through their nostrils and get to the back there, and you swab. And then you put that sample and you send it into the laboratory, where it would undergo a number of processes, and then we try to detect the virus itself or the DNA from the virus. So that is what is important. So these PCR tests are extremely accurate, and that's what we have been using. Now, there are other systems that are becoming more available that can detect the virus, but in a shorter period of time. And some of these systems are broadly referred to as point-of-care systems, meaning that you do not need a lab. You can come to a clinic where they have them, and you can do your tests, and they give you back the results in 45 minutes. The accuracy is not the same as a PCR test, right? And therefore, people need to understand that. My understanding is that there are a number of private institutions that offer the antibody tests, not the PCR nor not the antigen rapid tests. they offer an antibody test. So if people are going to go to some of these institutions, they have to ask what type of test is being offered and then make a decision whether they would want an antibody test or whether they want to have a test that is going to be a diagnostic one, like a PCR test. And so I think for the public, they need to make that distinction when they go to these institutions. On the other hand, the institutions that are offering these tests should also explain to the person what are the tests they're offering and whether it's a diagnostic test or whether it's an antibody test. So whether you can use it for diagnosis or whether you can use it for screening purposes. So they should have an obligation to explain this to the persons who are seeking these tests. And I think once we are clear about that, then we know whether this is going to help you to know whether you're positive for COVID or whether you had a past infection.
Thank you very much, Minister. And how is the 24-hour system for increased test sampling working? How is that going?
So right now, we have set up 3 shifts. And so people work depending on the workload that we have. They would either work all 3 shifts, or if we have a lighter workload, they will work probably 2 shifts or so forth. So depending on the amount of samples that we have. At one point, you would know that we had a large backlog, and that was when we were doing more broad-scale testing. Because of that backlog, we had reduced the amount of testing that we did for people who were just walk-in. Somebody just feel like they want to have a test and they come in without having been in contact with any exposed person or so. They just wanted to have a test. We were doing that at one point in time, but we have now stopped. So we're taking more people who feel that they were exposed to someone who were positive for COVID, or we would do the testing for someone who has displayed signs of or symptoms of COVID. And of course, we are testing hospitalized patients, right? So we have these main categories of people. Then we also give priority to our frontline worker. So if there are any health worker who feel that they have, for one reason or another, been exposed to COVID, then we give that person priority to be tested in our system. So right now we have a manageable set of samples that would come in every day, and we are able to process these and in a timely manner. I think now we are doing 24 to 48 hours, we are able to get those samples out. And we have made some arrangements with CARF that if we have an excess of samples, that we can send them to CARFA. And we have some other arrangements. If we really have a spike in samples, that we can send some of those samples to the United States. And in some cases, we are now working to make sure that samples, instead of coming from Region 9 to Georgetown, that we send those across to Brazil, where we'll be able to process them faster.
Now, Minister Anthony, are there any plans to revise the guidelines to have more persons work remotely with, since there is a little rise in the number of cases at workplaces? That's a concern raised.
Well, a couple of things there. One, the guidelines are very clear. People have the options, but those would depend on their specific workplaces. So if your employer decides that they want maybe 50% of the staff to come into the workplace and the other 50% work remotely, that's a choice of the employer. We have some stipulations in the document, because what we don't want is that people are sent home and then when they're not being paid or they don't get a job, they're just sent home because of a slowdown in business. So we want to protect people's job as well, and therefore we want to have that balance, because we have gotten some complaints that employers just send people home. But on the other hand, we want to encourage that balance. so that the workspaces are not too crowded. And even when you're in your workspace, we want people to observe the rules. That is the social distancing, the mask wearing, the sanitizing of your hands, and so forth, because these rules must be applicable. And one of the things that workplaces can do is to rearrange how people work to make sure that they comply with these COVID guidelines. So if people previously had to work very closely together, is to ensure that you have a distance between persons so that they can, comply with those guidelines. There are various documents that have been produced about varying industries and the standards that they should have and how they can get their particular sectors ready for to be compliant with COVID guidelines. So we are encouraging sectors to do that and to comply, these workplaces to comply with our COVID guidelines.
Okay, Minister. Now, you're part of a number of meetings, some with the World Health Organization. Could you tell us of any recent developments as it relates to COVID-19 in general?
Well, the WHO, they do have a meeting once a week where ministers of health would usually meet as a collective, and we have an opportunity to hear discussions from the Director General, Dr. Tedros, and some of his top staff. So we have been in attendance at those meetings. You have presentations from various countries so that you can get a sense of what they have been doing in terms of COVID-19, how they have been responding, what were the responses that they got. And also, the technical staff there would give us some technical updates on where they are with things like vaccines and so forth, treatments and treatment protocols and other technical documents that we need to pay attention to. So it's quite a useful exchange of information. And of course, we have the opportunity to ask questions and to get answers for those questions. So it has been a very useful exchange. As you know, Guyana is also an executive member of the WHO board, and very shortly there would be an executive board meeting of the WHO as well. So we will be participating in that meeting. In this hemisphere, in this region, we are also actively participating with PAHO, WHO at the directors level. And we have been engaged with them in a number of meetings talking about vaccines, the mechanisms to be able to access vaccines, and we have been working very closely with them. One of those meetings that I attended, we had a very healthy discussion on access to vaccine. And as you know, Guyana has signed up with the COVAX facility, and COVAX is looking at 15 candidate vaccines that are in the phase 3 trial. And once any one of them proves successful, Guyana would benefit from those vaccines. We will be able to access those vaccines and bring them to Guyana. So we had a very good discussion on that. We have also engaged with Gavi, and we think, and we have been working with them, and Gavi has made Guyana one of 10 countries that would be eligible for a subsidy, meaning that if the vaccine costs, say, $10, that Gavi would take a substantial component of that cost. So Guyana would pay far less than the actual cost of the vaccine. Gavi is yet to make a definitive decision on the amount of the subsidy. They have already agreed that they will give us a subsidy, but the quantum of the subsidy, they are going to decide at the end of this month. So once we know that, we will then know how much on behalf of the government of Guyana we'll have to put in so that our entire population can benefit from this vaccine. But while we do that as well, one of the things that I want to say to people is that we have started, and we will start to prepare our health workers, train them so that they can administer vaccine. A lot of them are already trained because they've been doing this with some of our other immunization programs. But we want to train more people because once we get the vaccine, we want to be able to immunize a large portion of our population very quickly so that we can return this country to some sense of normal.
Thank you very much, Minister Anthony. And just for reinforcement purposes before we close off the program, what are some of the key guidelines you would remind people to follow as we try to tackle COVID-19?
Well, I saw somewhere that there were 3 Ws, so that might be simple to remember. 3 Ws. Wear your mask, wash your hands, and watch your distance. And I think if people remember those 3 Ws and apply them, then, we all would be much safer.
Thank you very much, Dr. Anthony, and thank you very much to all the viewers and listeners. This has been COVID-19 Update. I'm Stacey Carmichael. Goodbye.